So I received a question from a viewer about complex regional pain syndrome, and he wanted to know how someone with both RSI and CRPS differentiate between trying not to overdo the RSI, also not over resting, avoiding pain that is related to complex regional pain syndrome. This is actually a two-parter, Dr. Markison. We should probably define complex regional pain syndrome, otherwise known as RSD, reflex sympathetic dysfunction, and a couple of other names. So help us understand this, Dr. Markison.
This goes back 150 plus years. Silas Weir Mitchell, the great Civil War physician, described among soldiers complex regional pain syndrome. And he realized even then that sometimes it's a peripheral nerve that's been injured and then reverberates as pain out of proportion to the injury itself, with labile up and down circulation in the hot phase of complex regional pain syndrome, which incidentally came about circa 1994. We decided to change RSD to complex regional pain syndrome, wherein you can have a discrete nerve problem or a kind of a generalized hot pain syndrome. In either case, you have to be aware that it can certainly overlap repetitive strain injury. And the idea in complex regional pain syndrome is use it or lose it, because you'll otherwise stiffen up. And I've seen very fibrotic, stiff hands where I've had to release ligaments and get things moving again. You're lucky in a way if you've got the type of complex regional pain syndrome where nerve studies show a discrete nerve entrapment that may have been overlooked. You decompress the median or ulnar nerve at the wrist, or decompress the ulnar nerve at the elbow, rarely decompressing the radial nerve in the forearm, and then quiet things down because you have the source. If you don't have the source and it's more diffuse type of CRPS, it's a bit more difficult to treat. But back to the concept of overlap, you want to, again, be monitoring the moment and monitoring the next day, but you also want to be fine-tuning endocrine metabolic status, because if you get vitamin D deficient, even for days, then you're going to have reverberating complex regional pain syndrome. Almost all CRPS patients go in vitamin D deficient and to some extent B deficient. These are all things that are measurable, and as are trace elements, magnesium, and so on. And so you want to fine-tooth comb hypothyroidism, a risk factor, non-diagnosed or inadequately supplemented, risk factor for CRPS and RSI. So there are pathways that feed into it: alcohol abuse, abuse of some drugs, family tendency towards it, history of same in other limbs or in the same limb as a recurrence. And then you realize that in this overlap, there are common pathways that may feed into either diagnosis. And so again, fine-tune endocrine, metabolic, general physical status, hydration, so on.
I have a question about that, because if we're talking about vitamin D deficiency or B or the other things that you mentioned, would it make sense? I mean, there's also the possibility of overusing vitamins, so you don't want to overdose on any one vitamin. But do you think it would help to sort of up the, if you're taking 2,000 international units of vitamin D, would it help to take another pill for a bit and see if that helps?
Yeah, but the word is liquid instead of pill for D, because gel caps and capsules are poorly absorbed, but liquid D3 is very well absorbed, typically 1,000 international units per drop, and 3,000 to 5,000 international units. But if you're very petite, you might go 2,000 international units, but the metric is blood hydroxyvitamin D levels. And I agree with the rheumatology literature that those levels should be maintained in the ideal range of 50 to 80 nanograms per ml, substantially above many labs saying 20 nanograms per ml is the lower end of normal. But in the age of COVID, and with the progressive understanding that vitamin D co-regulates the transcription of 5% of the genome, and there's a D receptor on each of your 3 trillion cells, including 86 billion brain cells. D is not just a vitamin. It's a co-regulator of DNA. It's a receptor on all T and B cells. It's intimately involved with immunity. All the deaths from COVID have included D3 deficiency, among other comorbidities, and so on. So D is critical, but the B vitamins are important as well, and those are all blood measurable. And you can take any form of B vitamin, except B12 should be taken sublingually, and 2,500 micrograms every week or two would be fine, letting that dissolve under the tongue, sublingual. But even in a B vitamin complex of any type, a pill and capsule and so on, you'll get plenty of B2, B6, 12, and so on.
You just answered my question. I was going to ask you whether a B complex would be a good idea.
Been reviewing workers' compensation cases for the state of California as a qualified or agreed medical examiner for 40 years. And in so doing, I'm always going through thousands of pages of medical file and looking to see, did they check the D level? Did they check did they check thyroid function? Did they check fasting glucose, fasting, did they check? No. And then turns out you get the screening, comprehensive screening, and you find out, okay, at the heart of all of this, of course, there was some work relatedness, is a fundamental problem, metabolic endocrine problem. And it's sad that people suffer so long, so hard for lack of cognitive filtering among those who evaluate them from the beginning.
Well, Dr. Markison, sometimes I like to tell people that this channel is like having a really great example of really good medical care, because so many people don't have access to a doctor, even a fraction as knowledgeable or as clear as you are. So it's another reason why I am so grateful that you take the time to come onto the show and explain these things to our viewers.
Well, I'm grateful to be available and functional. The COVID fallout has included the retirement or even death of many medical experts who've seen 30 or 40 strangers possibly infected, getting infected, dying, and or wanting to avoid risks, so dropping out of clinical care. And I understand it. So many sages have looked at the door and walked through it.
Another reason why we're happy to have you, Dr. Markison. Thank you so much again for your time and explanation of this very important topic.
Humbly yours.